the work that we do in our community for our older adults and for people that care for them. So with that, I want to move forward. We're going to talk a little bit about our COVID update and walk through all of the PPE pieces so you guys are better equipped to do the work out in the field. And give me just a second because I got to get rid of this. There we go. So just to give you guys a little bit of an introduction, and I'm having a little bit of issue with my computer, so bear with me a minute. There we go. So as you guys know, coronavirus came out early in December of this past year in China. And one of the things I think is really important that we understand is that there are many different kinds of coronaviruses. The common cold is very much one of those types of viruses. But this particular virus, COVID-19, we found first in China, and that's where the outbreak started. And at the time that I created this particular slide, we had 100,000 cases. That was as of March. As we all know, those cases have grown exponentially, and we're also seeing a lot of growth in our communities. So doing the things that we can do as people in our communities, not only as citizens, but also as people that are caring for others, is going to be really important and impactful in helping us slow that spread of this particular virus. And again, right now, when I did the PowerPoint, we had 700 cases in the United States. Well, right now it's well over that. We also have all states reporting, and this is continuing to grow. What we do know is that the vaccine is certainly under investigation. They are in trial phases with different vaccines right now for COVID-19, and hopefully we will all see some type of vaccine available within the next 12 to 18 months, and it potentially could be sooner. There are some experimental antivirals that they're utilizing now as well in treating the cases worldwide. So more to come on that as we see this particular virus continue to unfold, and also continue to see the world really work to combat the virus and help people stay safe. We do have cases reported in Montana, so I'm going to skip this. What we do know is that it is a person-to-person spread. So it is considered transmission through respiratory droplets. So whenever we talk, we cough, we sneeze, we sing, all of those things, we all naturally express droplets. And so whenever we're working with another person, we're expressing those droplets as we're having conversation. And those droplets then can land in the mouth and noses of people that we are with that are nearby, and that's how we inhale them into our lungs, and that's how those exposures occur when we're around people with active COVID-19, but it can also be things like influenza. It is similarly spread. Stuck again.
Oh.
Sorry, it's frozen. Not sure why it's doing that. There we go. There we go. And then the other thing that we're finding with COVID is that it's spread via contact with contaminated surfaces and objects. And that's why we're seeing so much about, doing the routine wipe downs of door frames and, things like remote controls, all those high touch surfaces, and having a lot of caution about touching our face, our eyes, mouth, nose, because when we're touching an infected surface and then we touch our faces, our hands are very contaminated. And so those droplets can then be spread in those methods as well. And one of the interesting facts, and this really has not changed over the course of the last almost year that we've been aware of COVID, is people are most contagious when they're showing those symptoms. So those early symptoms when people are experiencing the coughing, the fever, and some of those kinds of things, sore throats, that's when they're finding people are most sickest. Symptoms typically can appear in about 2 to 14 days after exposure. And when COVID-19 first started, there were 3 primary symptoms. We had fever, cough, and shortness of breath. As the virus has progressed, the CDC and the medical communities have added to that list of those common symptoms. So it's really important that if any of us are feeling any of these symptoms, particularly fevers of 100.4 higher, coughing, and especially shortness of breath, it's very, very important that we contact our healthcare provider for further instruction. And they're going to be the ones best equipped with directing us on testing, seeing those providers, and those kinds of things.
Click it again. I think when I touch it, it's already.
So we already know that those folks that are at highest risk are our older adults and people with severe underlying chronic medical conditions or weakened immune systems. These are our folks that have heart, lung, kidney diseases, diabetes, going through any type of immunosuppressive therapy like cancer treatment and things of that nature. So what the CDC and the medical community is finding is that this population is at higher risk due to those underlying medical conditions when they're exposed to COVID. So we do have recommendations for businesses, and what you've all experienced with not only in the community and in your personal lives, but we here at MAS, when everything came down in March and COVID started to appear in Montana, we went under basically a stay-at-home order. And Missoula Aging Services, while we continued serving our clientele and working behind the scenes, we had to close our doors to the public. We are currently still closed to the public, but we're continuing to do the work that we do every single day. And we want to make sure that we are able to continue to do that. So here in the agency, we put all of these safety mechanisms that we're talking about today here as well. And that's why we're sharing a lot of that with all of you. So one of the recommendations is for all of our staff, and we will be working with you and continue to work with you for the same kinds of things. If you're mildly ill, we're going to ask that you stay home. Particularly now we're entering into the influenza seasonal flu season. And so we don't know, because the symptoms can be very similar, what it could be. So if any of us are mildly ill, we're going to be asked to stay home. And oftentimes those mild illnesses can just be a virus, it can be a cold, it can be something that really is benign and not symptomatic of COVID. But quarantining staff, if they're coming into the office and they start to feel ill, we want to make sure that we're having conversations with them, we're sending them home, we're providing instructions on contacting their healthcare providers for follow-up care and things of that nature. Using our respiratory etiquette is very, very important, and it's really not different than what we've always done. When we sneeze, when we cough, we're either to utilize a tissue or coughing into our elbow instead of our hand, because our hand is touching everything. So when we cough into the palm of our hand or sneeze into our hand and we don't wash our hands directly after, we now have a surface that is contaminated, and everything that we touch is comes in contact with those droplets that are now in our hand. And we want to be thinking about using universal precautions as we're caring and meeting clients. So the work that you all are doing out there every day, you're working with our clients as our volunteers, an extension of all of us. And so those universal precautions as you're meeting with everyone is going to be very important. And we're going to talk about those things today. Some of the things that we're doing as far as mitigation, you're hearing and probably bombarded by the media, by the CDC, by a variety of different kinds of sources. And what we're doing here is we're really trying to work to limit the exposure and slow the spread of the virus over time. And by doing those things, the stay-at-home order was a very good example. It really helps to reduce the impact of the spread of the COVID virus. It also helps to keep the healthcare system so they can better manage cases as patients come in who are exhibiting symptoms. And so here's some of the steps that we're continuing to take. This is not new information to all of you, I'm sure, but our social distancing is going to be remain important. That's 6 foot. When you cannot maintain 6 foot distancing, that's when you're going to keep your masks on and things of that nature. But that social distancing is a protective mechanism. And one of the challenges for all of us is we want to hug people, we want to shake their hands, we want to engage in those things that we do as people that are very important to us to remain connected. And so we're asking, you know, elbow bumps and, you know, not doing handshaking, keeping our 6 foot distance, being sure that we're doing really good hand washing, hand hygiene. So that's washing your hands often, probably more than what we normally would. And we want to make sure that we're using soap and water, and singing happy birthday to ourselves 2 times is about 20 seconds in duration when we're doing that hand washing. Good respiratory etiquette. And we don't realize how many times we touch our faces, we rub our eyes, we touch our lips. All of those things, they're just normal things that we do as humans. And we do those hundreds of times a day. So having a real conscious thought of, oh gosh, I'm going to touch my face, I can't, is really, really important to helping not only protect ourselves, but it helps to slow the spread. And being willing to self-isolate, even if we're mildly ill, until we can get our arms around what those symptoms that we are experiencing. It may be just something that's 24 hours and we feel just fine the next day. We do have some guidance for home. And those are things that we're thinking about when we have people who have experienced symptoms of COVID. We want to make sure that the symptoms and the individual are stable enough to get care at home. And most all of our people that we're seeing in the United States and worldwide really do remain stable enough to receive care at home. And they're going to receive that direction from their healthcare providers. The caregivers that are involved and available, we want to make sure that there are people, should someone need additional care and support at home, that they have that support and care at home. And it's also really important that if there's a separate bedroom where the patient can recover without sharing immediate spaces, we want to make sure that people are being thoughtful of that. So we're kind of doing some separation of individuals who have been diagnosed with COVID or and have been ill, are really kind of separated from the rest of the family. And that allows our family members and our loved ones and those caring for us to keep our surfaces clean and wiped down, and just keep that little bit of separation as those individuals are able to go through the illness and go into the process of recovery. And then other things that are very, very important, and these are things that you guys may experience from the clients that you're serving, doing those check-ins when you're delivering meals, when you're touching base with our senior companions, when you're talking with our teachers in the schools. You know, we want to make sure that there's good resources available, and our agency can provide those resources and information about those resources for food and the things that are necessary so that people can stay within their homes. The patient and other household members, we want to make sure that they have personal protective equipment, so gloves and face masks, and that they're capable of adhering to the precautions that are recommended as part of that home care isolation. So again, respiratory hygiene, good cough etiquette, hand hygiene, all of those things. And our household members, our family members that are residing with us can be at increased risk of complications, particularly if we're in that older 65 years of age population. Again, we have underlying health conditions or immunocompromised. Our young children and pregnant women also can be at risk, as we've already talked about. There are tons of resources out there available to all of us. One of the things that I've shared with all of our staff here, because we tend to get bombarded with communication, is really utilize the Missoula County Health Department's website. They are working directly with our state health department and also for the Center for Disease Control. And we found that it is a lot easier to utilize a couple of sources than trying to digest information from so many places. We're finding that that information is very, very consistent, and it's really been very supportive for all of us as MAS staff to kind of narrow things down and just use a couple of resources. So let me pop out of here for a moment. Let's see. Sorry about that, guys. I'm having just a little technical here for a minute. You know what I did, Laura, is I pulled up the wrong one. Okay. There we go. Okay, bear with me just a second while I get us to our next step here. Okay, let's see here. Okay, let's take a look here. There we go. Okay, bear with me one more second here. Okay, can you all see that? Okay, so what we want to talk about now is how do we use our personal protective equipment? One of the things that we want to be thinking about is the work that we will be doing. So we're going to talk a little bit about selecting it and how to take it on or put it on and take it off. Let's talk a little bit for a minute about what personal protective equipment is. So OSHA tells us that personal protective equipment, or PPE, is really that specialized clothing that we wear in order to protect ourselves against infectious materials. And so the definition really includes all of us. So volunteers, family caregivers, employees, and other people that are involved in the care of another person. One of the things that's very important that we all understand is that OSHA has a definition of infectious material. So they're going to be things like blood and body fluids that contain blood. For all of us in the work that we're doing, our risk for coming in contact with human body fluids other than the droplets from people speaking, all of these things that you guys are seeing, is going to be extremely low. And virtually very, very little risk to all of us because we are not actively working in a hospital or in a healthcare environment. So there's various types of personal protective equipment. For the work that all of you guys are doing, the things that you'll be using most commonly are going to be your masks and your gloves. So your gloves protect your hands. For our direct care staff that are working directly with clients in their homes, they will be using gowns. We do have masks and respirators, and we're going to talk about the differences. Surgical masks, and then again, those respirators, the ones that we're seeing in the healthcare environment, these protect the respiratory tract for those people that are actively doing care in a hospital setting. So you will see people in hospital settings wearing what's called an N95 mask. This is a special mask that requires special fitting so that there's no inhalation of any kind of airborne infectious agent with that particular type of mask. What we will be doing in our setting is really a surgical mask or a cloth mask. There's also goggles and glasses that are used in a healthcare environment, and you've probably seen out in the community, some people are using face shields, which they're finding is one method of protecting others from droplet spread. And also has been really helpful for people that have difficulty breathing through just a regular surgical mask. So when we start to think about our PPEs and the factors that influence what we select, we're thinking about the kind of exposure that we're anticipating. So in a hospital setting, it's typically going to be a splash or a spray kind of exposure versus touching a surface or touching a person. And then there's categories of different types of isolation precautions. So for example, in a hospital, if I'm entering a client room that has been diagnosed with tuberculosis, that's one type of isolation precaution. And we're trained in those hospital settings on how to make those determinations. And those signs you guys have probably seen in hospital environments posted outside of someone's room where it talks about different kinds of isolation precautions. We also want to think about the durability and the appropriateness of the personal protective equipment as we're doing a particular task, and then how that PPE fits. So when we think about our gloves, the work that you guys are going to be doing and are doing is we're going to be using a disposable glove. So we're going to be thinking about as we hand off a meal to a client, as we are working in a school setting, as we're working with our senior companions, it's very, very likely that we'll be utilizing a glove because it's a barrier between us and the client that we're coming in contact with. In addition to that, we also use gloves for environmental type services, like if we're cleaning, doing any kind of housekeeping, a lot of our household tasks. We may utilize gloves for doing dishes, doing laundry, stripping bedding, those kinds of things. And our glove material is made of a variety of different types of materials. So there's vinyl, there's latex. A nitrile is more of a puncture resistant type of glove. You've seen them at Costco, they're blue, or they can be a kind of a gray color. And then there's other kinds. And the gloves for our purposes are non-sterile. So we open a box, we pull out the gloves we need, and those are the ones that we're using. One of the things that's really important that we want to be thinking about is the do's and don'ts of glove use. So whenever we put a glove on, we're putting them on our hands. We use our hands a million times during the day. And so you want to be thinking about when you don a pair of gloves that you're going to be working from a clean surface or a clean process to a dirty process. For example, as you're getting ready to hand off a meal to a client, you're going to use clean gloves to hand off the meal. But as that meal is handed off, your glove potentially comes in contact with the client or other surfaces, it then can become dirty. So those are the kinds of things that we want you to be thinking about when you're working from that clean to dirty process and you're working with your clients. So you want to think about limiting your opportunity for touch contamination. They're your hands. So the more surfaces you touch, the more contaminated the glove becomes, and the more risk that you have with protecting yourselves and other people when your gloves are dirty. So even more important is when you're wearing your gloves, you really want to be thinking about not touching your face. It's a challenge because we're wearing a mask. Masks slip, our noses drip, we sneeze, we cough, we have an itch. All of those things are really natural things, and we're finding that they're more maybe present because we have a mask on our face. So we want to really be thinking about not touching our face as much as we possibly can. And also, as soon as you touch your mask with your hand, you have gloves on, you've just created a contamination or an opportunity for that touch contamination like we talked about. Environmental surfaces, again, you want to be really thoughtful of going clean to dirty and really limiting as much as you possibly can those touch points. Changing your gloves is really important. You want to always change your gloves in between client use. In our home care settings, for our staff that are doing personal care, they're going to change their gloves often. So if they're doing actual hands-on personal care, where they're helping with bathing, grooming, dressing, those kinds of things, they'll wash their hands, put their gloves on, do the process, take them off, wash their hands, and then they may put a new pair of gloves on to strip bedding. So those are similar kinds of activities that you guys will be thinking of when you're in the schools working with the students, working with the teachers, moving from surface to surface, similar kinds of situations in our senior companions, home environments, those kinds of things. So again, keeping those all in mind. And then always changing your gloves after use on each client. So if I deliver a meal, when I go back to my vehicle, I'm going to want to make sure that I'm discarding my gloves, using my hand sanitizer, and before I touch that next meal, I'm going to go through the same process. And we also want to ensure that we're never washing or reusing disposable gloves. They break down, they get pinholes in them, and they lose their effectiveness if we're constantly washing and reusing something that's not meant to be reused. So when we start to think about our masks, right now the CDC, of course, is recommending that we wear a mask in public settings. This isn't in a situation where we're exercising, where we're not around other people, or we're going for a walk, or we're out in the open environment. So if we're in a public setting, for example, if I'm walking around the mall is recommending that we wear a mask in that public setting. We're wearing masks when we go into restaurants, but we're able to take them off when we have our meal. As soon as we get up to leave the restaurant, we put our masks back on. It's also recommended that we're wearing our masks around people who don't live in our households. So we're not accustomed to them. We're not accustomed to, their germs and the things that we're all exposed to as humans. Also, again, maintaining that 6-foot social distancing is really, really important. And we all know that Missoula County currently is under a public mandate to wear protective face coverings when we're in those public settings. One of the things you guys probably have seen as you're driving around our community is 2 people in the same vehicle both wearing masks. If those 2 people aren't in the same household, it's probably a really good idea for them to do that. If I'm with my husband and he's in the vehicle with me, we reside in the same home, we're not wearing a mask next to each other. We live with each other. But as soon as we exit our vehicle and we go into a public setting, that mask goes on our faces because we want to make sure that we're doing our part to protect those around us as well. Your masks, again, as I just shared, that's that additional step to help us all slow the spread of COVID. So when I apply my mask, I am considering protecting you from me, from my droplet spread as I'm coughing, sneezing, talking, those kinds of things. And when someone that I'm working with or that I'm sharing time with, their mask does the same for me. So it's really a shared responsibility that we have as people to protect those of us that we're around. We want to make sure that we're fully covering our mouth and nose. And you probably have all seen the crazy ways that people are wearing masks. So they're wearing them around their neck. They're dropping them off of an ear. They're putting them around their wrist. The inside of your mask, you want to understand, is not clean. So when you touch the inside of your mask with your hand, when you touch the inside of your mask on your wrist, when you're wearing it around your neck, you have the potential of touch contamination from the inside of that mask because we're breathing on it. And then also remember that the cloth or surgical style are the kinds as we as public should be wearing. We should not be wearing masks that are intended for healthcare workers, such as that N95 respirator style. We want to reserve those masks and that inventory for the people that are directly caring for all of us and our family members should we become ill with COVID and some of those other kinds of situations. So let's talk a little bit about how to take it off and put it on with regard to our PPE. So when we're getting ready to have client contact or when we're at dispatch, for example, with our Meals on Wheels deliveries, we want to make sure that we're thinking about, are we wearing our PPE? We're going to wear it before we enter a home, if we're doing deliveries, if we're working as a senior companion, if we're going into the school systems. And we want to be really thoughtful of using it carefully so we don't spread contamination. Also, we want to make sure that we're removing and we're discarding our PPE very carefully. So again, be thoughtful of discarding it if possible in a client's trash receptacle. If you're in a vehicle, if you have a separate trash receptacle where you can dispose of it and throw it away in that means, it's a good way to do that. So, and we want to be really careful and thoughtful of immediately doing good hand hygiene. So here's our sequence. Before we do anything, before we put PPE on our body, we're going to do hand hygiene. You all should have hand sanitizer. So one of the things that we want to make sure that we're doing is when we're putting on our hand sanitizer, and I'm just going to demonstrate this for you. And I'm going to kind of just open up my screen here so I can kind of see. There we go. So can you all see hand sanitizer? When I put this in my hand, I'm going to do a good dollop of it, and you want to get the front, the back, do your wrists, and don't forget the back sides of your hands. This is all sources of contamination. And then let your hand sanitizer dry. It should be 60% alcohol, and it's going to dry fairly quickly. One of the things that's really easy for us to do is, you know, I immediately want to wipe my hands on my clothing. Well, I just defeated the purpose because I'm probably leaned up against things with my clothing. So hand sanitizer is really important first. And we want to do that before we put our stuff on our bodies. And then the very next thing that we want to be thinking about is putting on our PPE. So my hands are clean. I have a clean mask, and there's two sides. This is a disposable mask. I've seen them worn white side out and blue side out. Well, my background is healthcare. So growing up in the healthcare environment, the blue side is my outside. My white side is my inside that goes against my face. So I have clean hands. What I'm going to do with this ear type is I'm going to put it up over one side of my ear. I'm going to grasp the outside of my mask and just guide it over my face so that it's now over my face. Touch the outside is fine. And if you guys can see, I want this to fit my face and go around under my chin. So just gently grasp the underneath side of your mask and gently pull it down under your chin. And then you have an adjustment right at the top for your nose. And you can kind of pinch that little bar so your mask is fairly secure on your face, okay? The next thing I want to just show you is I've put this on. The next piece that you're going to be using most frequently is going to be your gloves, and you want your hands really clean. I tend to be over the top with my cleanliness because of just my background. So before I put my gloves on, the next thing I'm going to do is I'm just going to do a good shot of hand sanitizer again, and I'm going to get the front and back, and then I'm going to pick up my glove and just kind of tuck your fingers underneath it and pull your glove on. Just pull it over the top of your hand. And then your next glove, if you can, kind of grasp an edge of it and then tuck it on. And then you're ready to go. And then you can do your meal delivery, work with your senior companions, whatever it is that you need to do. When you finish your task, that's when you want to start thinking about, what do I take off? What do I do next? So I'm going to leave this all on as I work through this, and I'm going to show you what some of those next processes are. So I'm going to kind of skip over a couple of things because I've just showed you what we are going to do. And then think about, again, these are my hands. So everything I touch causes contamination. So if I'm touching my face, if I'm touching a surface, all of those things are really important. So just be thoughtful of moving from one thing to the other. Limit as much surface touching as you possibly can. And if you tear a glove, if they get dirty, take them off. Hand hygiene, put on a new pair, because they're there to protect you as well as the people that you're working with. Also really important, the outsides like particularly for a gown or for your gloves. That's your contaminated surface. So be thinking about when you're taking things off, like my mask, I want to be really thoughtful of, I don't want to touch, I don't want to set it down like this, okay? You're going to fold it in half and lay it down, all right? And we do all kinds of crazy things with these because they're not normal for us. As many years as I worked in the hospital, it's still not normal for me. I took care of patients in critical care for many years, and it's still weird as many years as I did that. So it's just an area that we want to do the very best that we can, and you know, help remind each other. So how do I take this stuff off? What comes off first? So in the order of sequence, you have your gloves and your mask. So what we're going to do is, how do I take off these little buggers? So this is dirty. This whole surface is dirty. I'm going to put my thumb underneath it, and I'm going to take it off inside out. And I'm going to just keep a hold of it. I'm going to ball it up in my hand like this, and then I'm going to take the top and I'm going to turn it inside out of itself. This surface inside my glove is clean. Okay, and then I can take this and I can dispose of it in the trash receptacle. What I want to do next, when I take off my mask, guess what? I'm gonna use my hand sanitizer again. It's just a good thing. It's a process I've always done. And then I'm gonna take my mask off. So I'm gonna pinch the outside. I'm gonna slip the two elastics off my ear. I'm gonna fold my mask in half, and then I can set that mask down on a surface, okay? And we reuse the surgical masks. I will reuse throughout the course of my day, and I use a new mask every day. You guys may find that you may need to do it more often, and if your PPEs are running low, you definitely want to talk to your volunteer coordinator and let them know. Also, same with your hand sanitizer. For those of you that are using a cloth mask, the process is exactly the same. It's no different. One of the things that is super, super important though is be sure you're washing your cloth mask on a regular basis. They get dirty, and you know, we have facial oils and we're breathing through them and those kinds of things. You want to wash those cloth masks at least every other day at the minimum. Hot soapy water in a washer and dryer is sufficient. Don't put them in the microwave. We've had a lot of people throughout the country that have started fires in their microwaves. So hot soapy water works really, really well. And then one of the other things you can do is just hang them to dry also. So those work great. For those of you that have ties, the process is really similar. So clean hands, and then your mask itself, you're gonna grasp by the ties, and you can tie the top and then come around the bottom and tie the bottom. I like the ear pieces a lot better, especially with my dexterity. I have a heck of a time holding a piece on my head to tie the back. This kind just works better for me. Please let your volunteer coordinator know kind of what your mask status is so that they can assist you guys.
And we do have more cloth masks if any of the volunteers need them.
Perfect. Thanks, Adrienne. So again, hand hygiene is one of the most important things that you can do. One thing I do think that you all need to be aware of if you're not is your hand sanitizer is only good for a little while. What you're going to find is your hands will start to feel kind of sticky and a little dirty. And so being really thoughtful, if you have the ability to wash your hands with soap and water after about a half a dozen to a dozen applications of hand sanitizer, you want to be able to do a good hand washing. It will lose its effectiveness after a period of time. So, you know, those are things that we all want to be thinking about as you're continuing to do the work that you are. As I mentioned, you want to wash your masks regularly if you're using a cloth mask, and use a high heat setting. those have all been found to be sufficient through the research that the CDC is currently doing. And that's kind of what we want to be thinking about, keeping those cloth masks clean. With that, we can certainly touch base on any questions that you guys may have as we've walked through this information with everybody.
I see Rocky has her hand up,
Okay.
but you're still muted, Rocky. There you go.
I found this this session very fascinating, but something was missing, and that is the name of the presenter.
Oh, well, thank you. My name is Sherrie. I'm the Human Resource Director here at Missoula Aging Services, and I get to do a lot of really amazing things here. So not only do I work with all the people, but I get to do a lot of the training and education and some of those things as well. So
Thank you, Sherrie.
you bet. Any other questions or concerns, thoughts, comments that we can assist with?
Cinch has her hand up.
I was just wondering, I was watching you fold your mask. So like when you're in a store and I carry mine in my purse, maybe that's not a good thing. So if I fold it in half with the inside, you know, fold it against each other, is that safe enough then to put it in my purse, or should I be laying it maybe on my seat of my car, or what's the best way once you leave a store or something to protect the mask from, you know, getting more contaminated? Or
That's a great question.
I'm not quite sure what you should do with your mask once you
Okay.
take it off.
Yep, great question. I think one of the best things that we can do is just carry a few baggies with us, like Ziploc baggies, and we can fold our mask and just tuck it with the loops up, tuck it in the baggie. I haul mine around in my purse too, Singe, and so that's what I do with mine, is I just have a little baggie that I tuck them in, and then I have a clean baggie where I have clean masks, so that if, you know, something happens with the one that I'm using that day, I can toss it. It's already in the baggie. I can throw it away. And then I have clean ones also in another baggie in my purse, so that I don't run out, or sometimes I forget, or if I switch purses. So I always have, in fact, it's kind of like Kleenex. I have them stuffed everywhere. Other questions?
Helen has her hand up.
Sherrie, you mentioned that there are 2 more symptoms that have been added to fever, cough, and shortness of breath. What are they?
Yes, absolutely. So what they're finding is chills and shaking, nausea, vomiting, diarrhea. Those are fairly new. Muscle and body aches also are symptoms, new symptoms. Probably since about this summer, they've identified, and the CDC has listed those as additional symptoms. And what they're also finding is that sometimes people have no respiratory symptomology at all, but they have the body aches and the chills and shaking, which often is indicative of a fever, but they may not have any of the other symptoms. And so they have expanded what that list looks like as this virus has progressed. And they've actually found that people that have been experiencing nausea, vomiting, and diarrhea actually are symptomatic of COVID. But early on, they did not identify those as symptoms. It was really those primary 3.
Neil Weir has his hand up. You can unmute yourself, Neil. Okay, well, Rocky also has her hand up. So Neil, you can take a minute to unmute yourself. There's Rocky.
Yes, Sherrie, you mentioned a whole bunch of symptoms, but I've read someplace that losing your sense of taste or smell is also among them. Am I correct on that?
You absolutely, Rocky, are correct. That is one of the additional symptoms, and thank you for bringing that forward. That one was off my radar. So yes, that is one of them. It's new scent, new loss of taste or smell. Yes, absolutely. So if it's something that's not normal for you and you've lost your sense of taste or sense of smell, absolutely is a symptom, is what they're saying.
So Neil, still muted. Okay. Look like Sanch had her hand up again. You're on mute, Sanch. You'll have to unmute yourself, Sanch and Neil, to ask a question.
I still can't.
Okay. So did anybody else have a question? Oh, Colleen Devlin?
Thank
Hello.
you. Yes, can you hear me?
Yes.
Yes.
Okay, I have a couple questions real quick. One of them, can you have the symptoms like nausea, muscle aches, chills, aches, and not have a fever and still have it? I mean,
Yes, that's what they're finding.
okay,
And
because I've had a lot of these symptoms and I have a cough, I have muscle aches like crazy, and I've been nauseous, for days, but I don't have a fever, so I don't go get checked.
Right.
Do
You
think
know, I think it's really important because we are all experiencing how we are reacting to the virus in very different ways. And it's really important. I mean, while we don't want to scare anybody or make people worry more, an awareness of those symptoms is really important. And so to your point, if you are feeling unwell, definitely contact your provider because they are finding that people can have COVID with some of those other symptoms. And here's the other challenge. There are other viruses that we have every season when we start to go into fall and winter that are present. There's also our seasonal flu where we can have muscle aches and some of those coughing and some of the respiratory symptoms. So it is very difficult to make the determination of what the virus actually is without medical intervention. And that's where your providers are going to come in and say, let's test you and see, because you could have the seasonal flu or you could have another virus that is going around, and it may not be the COVID-19 virus at all. But it's really important that if you're feeling unwell to make that contact with your healthcare provider so that they can assist you with appropriate care.
Okay, thank you.
You
One
bet.
more question was, if you have a cloth mask and then when you take it off and you come home, can you just spray that with hand sanitizer? Does that help on the outside?
I would not recommend it, no, because there's alcohol in your hand sanitizer and there's other components that are in that product that we may not necessarily want to be breathing through. Whereas if we just launder it, then they found it to be a much more safe way to clean our masks. Then we really want to avoid putting things on our masks. We want to just use our laundry, or you can hand wash them in really, really hot water as well.
Okay, thank you.
Yeah.
And Sanch has her hand up. Do you unmute, Sanch?
Is that better?
There.
Yep.
Oh, I was doing it the opposite. No wonder you
Yay.
didn't hear me. Okay, well, I have a couple different masks that were made from a friend of mine, and
Sure.
I'm just going to ask you if one is better than the other. So I'm going to show these to you. This is one that has the, I don't know if you can see it.
Yep.
And then there's another one very similar to what you had, where it had the nose adjustable thing on the nose. Is it one better than the other, or does it matter?
I think the biggest thing with your mask selection is you want fit. So whether it's a cloth mask or a surgical mask, the most important thing is getting good fit around your face. So if you've got big gaps and things like that, the protective mechanism of the mask is less. So really think about fit. So Sanch, if that other one fits you, that looks a little bit molded.
Fits over my nose, under my chin, way better than the other one. My head's really small. So,
Yep.
okay, thank you.
Yep, you're welcome.
And Sammy, did you have your hand up? Looked kind of like it. No? Maybe not. I was seeing things.
Any other thoughts, questions?
I have one more.
Okay.
What about the grocery store? Like your touch, I don't wear gloves when I go to the grocery store, but I wear my mask. And then you're touching, all the stuff and even the grocery bags. How long does the COVID or whatever stay on like material or, your groceries? I mean, should I be washing everything? I mean, the fruit and stuff I wash, of course, but I don't know. What's the procedure there?
Great questions. So, for grocery stores, definitely we want to wear a mask. So before, when I get out of my truck, I hand sanitize, I throw my mask on, I go into the store, I don't wear gloves either. I go into the store and do my thing. When I leave the store, as I'm walking out before I touch my keys or anything, I will hand sanitize, load my groceries, and then it depends on the surface. Some surfaces are longer than others, and so I use my own cloth grocery bags, and then I launder them after I come home from the grocery store. So it depends on the surface. Plastics, they are finding that it's adhering to the plastics. I can't tell you off the top of my head what the duration is because it depends on how porous the surface is. Paper, plastic, like a hard surface like wood. So it's going to vary a little bit, but I would just use your same protocols when you're out in public, your mask, your hand sanitizer, and those kinds of things. And if you're concerned, certainly you can launder your grocery bags. And they do recommend washing all of your produce. I even have, family and friends that dump their produce out on the counter and then they discard the plastics that the produce came in, and then they repackage after they wash all the produce and put it in their fridge. So I think it's really a personal preference on where your comfort level is.
Right. Sammy does have the hand raised icon, so unmute yourself, Sammy. Anybody else?
You guys can also type in the chat box if you have a question. Adrian's helping me man that as well, so we want to make sure we get your questions answered.
Sammy's off mute now.
Okay, Sammy, go ahead.
Yeah, I have a question for Sherrie, please. Adrian, I'm 73-year-old. I have a defibrillator. I have a pacemaker. Once in a while, my symptoms are you get short of breath. Shall we have to be checked about it? Yes or no? I mean, Dr. Muska said that's the part of the symptom you have. What Sherrie think about it?
Sammy, I think it's really important that you adhere to what your healthcare provider is telling you to do. If you or your son have changes in your health condition that are different than what you currently are experiencing, it's important to communicate that with your healthcare provider. They're going to be the people that are best equipped to say, I think you should be tested. I want to see you in my office, or whatever it happens to be. So I would absolutely rely on them if it is something different than what you are currently experiencing.
Okay, thank you.
You're welcome. Carolyn.
Yes, yes. Well, first of all, I just want to say thank you. This has been very informative, and I enjoy all of the material that we get, and I'm really, really pleased with this today. One of the things that I've noticed when I go to the grocery store is that there has been holes poked in the packages of toilet paper or paper towels or things like that. And I think it's people trying to feel the texture before buying. So I have found that I have been purchasing items that are farther back in the row, canned goods, packaged goods, and things like that. I feel like maybe they've been there maybe a few days longer, and certainly haven't been touched by the people who are walking up and down the aisles, if that helps anybody. And secondly, I've got a place I have to be at, so I'm going to have to go. So,
Thank you
but
so
it's been
much, Joanne.
wonderful, and thank you.
My pleasure. Any others before we drop off today?
Jane, thank you again. This was a really very informative, interesting, awesome meeting. Thank you so much.
My pleasure. Thank you all very much for everything you do for us.
And I just want to say, if any of the foster grandparents or senior companions have questions for Laura and I, after we finish up these questions, we'll stay on and answer your questions. But if you don't have any questions, you can sign off. Sherrie, I see Ann Groth has a question. Can you unmute yourself, Ann? Oh, she's on the phone. It's a little harder to do. Michael also has a question. If you want to unmute yourself, Michael. Is Rocky still on? She knows how to unmute yourself. I don't have it on the phone. I don't have it in my head. It's star something. Star six. So Ann or Michael, if you can push. There's Michael. Okay, you had a question, Michael?
Yeah, I have it. Laura, do we fill out the training evaluation form for this class?
I don't think so. What? Yeah, Laura's shaking her head no, because you were here. We saw you were here. It's okay.
And you put down the hour or hour and a half.
Yes, yes, definitely write down the hour for training hours. Yep. And Ann is unmuted.
Hello, can you hear me now?
We can hear you, Ann.
Oh, wonderful. I'm noticing, I don't know, is it a contradiction? In the first package of literature, it pertained to face shields, protect face, mouth, nose, and eyes. And in the second packet, the most colorful, when it comes to other caution, it says evaluation is ongoing, but effectiveness is unknown at this time pertaining to face shields.
Yes, so pretty new information. Currently, face shields are being used because we have a lot of population that are having difficulty breathing through masks. So the face shields came out initially not that long ago, and people are continuing to use them. However, again, as the virus continues and we learn more and more about it, they are looking at the use of face shields as protection. Because they are open on the bottom, whereas a face mask is not.
Right.
So there is potential for the droplet to fall. And that's why the 6-foot distancing is so important, is because they're at this point saying that that's enough space for it to fall out and reduce our risk of exposure. The other thing are like the neck gaiters that you're seeing people wear instead of a mask. And so they're doing research on those two particular products to give us more information, because they're just not, it's not as known of a thing as a face mask, because the face masks have been around for so many years. We've used them in the healthcare environment forever. So very good question. So more to come, you know, and as I get more information, and as we as an agency do, and Laura and Adrian, those are pieces of information that we'll continue to share, because it's going to keep changing. Where we started in March and where we are now in October, as far as our knowledge and what we are doing about the virus and about the protective mechanisms, is very different. So it's going to just keep changing, and we want to keep everybody informed as we all go through this together.
Right. And my understanding is the coronavirus is mutating and has been mutating.
You know, and I can't speak to that. I mean, I'm certainly not a scientist. I think what they are finding is that because it was brand new and what they initially knew about the virus compared to what they know now definitely is different. They have more information. They have a larger population that have been ill with COVID-19. But as far as any kind of mutation, I really can't speak to that and really effectively answer your question.
Okay, thank you.
You bet.
Anybody else? Questions on PPE? Okay. Well, thank you very much, Sherrie. Appreciate you giving this education to the volunteers because, you know, someday we'll go back to serving in person. Some of you already are outside and it'll be important information to have.
Absolutely. All right. Thank you all. My pleasure.
Right. Does anybody have any questions for Laura or I before we sign off? Oh, Josie? Josie's on the call. Where'd she go? She has her hand up. Oh, yes. So you're not muted, Josie. Go ahead and ask your question. Okay. Anybody else? No? I'm glad we haven't confused people lately.
Judy Krieger, your hand is raised, but you're muted. So if you could push *6 on your phone, that'll unmute you and then you can ask your question.
There. Now you're unmuted, Judy.
There, I'm sorry, I really messed up the time here. I was positive it was 11 and I kept telling myself, no, it's 10 this time. And then when I set the alarm, I messed it up. And so do you have this recorded somewhere?
Yes, we are recording it and